So what are dental implants? Well, if you have already lost a tooth or you've been told that one of your teeth needs to be taken out and you're looking for a solution that will closely mimic a natural tooth, well, an implant might just be for you. So it's the most advanced way for us to replace a tooth. Now, it always sounds a little scary, but in principle, it's relatively straightforward. So a dental implant is a small titanium device. It's about 10 millimeters long, so it's quite small, which is gently positioned into the gum, into the bone, okay? Now, there are lots of ways for us to plan this so that we can create a 3D guide that allows us to place that implant exactly where it needs to go. And then once your own body has healed around the implant, the implant becomes integrated into your jawbone. Once that's happened, anywhere between 3 to 6 months, we can then actually put a tooth onto that implant so it mimics a natural tooth and it looks like you've got your tooth restored. It can be used for one tooth, a few teeth. It can be used for your whole jaw if you have lost all of your teeth, for example. So there's lots of options for that. And we have a lot of data to say now that a dental implant really should be lasting you many, many years, decades. There's a bit of maintenance involved with it long term. You might need to have the crown replaced, so the tooth on top of the implant replaced. You might need the gum thickened up around the implant in the future, but hopefully that implant itself will stay there for a very, very long time. So the alternative to an implant would be a bridge or a denture. So a lot of people obviously don't want to have a removable denture, especially if it's just for one or two teeth. And a bridge does require holding on to your adjacent teeth, which in some situations is perfectly fine to do, and that is actually a very good option. But with an implant, because you're not relying on anything else, it's self-supported, it will, help long term because it's not relying on the health of those adjacent teeth to hold it in. So it's an independent option, which in some situations is the most appropriate thing to do. Now, the main benefits of dental implants are they are the most life-like option to replace a natural tooth. So it will resemble a natural tooth. You can floss around it like a natural tooth. You can clean around it like a natural tooth. And when done correctly, it will mimic aesthetically a natural tooth. It will look like it's coming out of the gum as a natural tooth does. It's going to last you the longest amount of time, and studies show that there's, on average, a sort of lower proportion of complications with implants. Of course, they have their pros and cons, which we would discuss together in person if you were to come in for a consultation. But nowadays, a lot of people are favouring an implant for the aforementioned reasons. So if you are interested in having an implant and, like I said, you have a missing tooth or you need to have a tooth taken out, obviously please get in touch. One of our lovely treatment coordinators will be able to have a complimentary video consultation with you to discuss things in more detail. And then we can see each other in the clinic for a much more detailed assessment of your mouth, and then we can talk about the process in a lot more detail.